A bioelectrical impedance analysis scale, BIA, provides a quick and non-invasive way to estimate body composition. The scale includes metrics such as body fat percentage, muscle mass, and overall hydration levels. Subsequently, it can be valuable for individuals as it tracks indicative fitness progress, setting well-being goals, and monitoring overall health status. It also provides helpful insights towards an individual's nutritional status, which would be used in line with other parameters. The mechanism is a device that measures body composition by sending a small electrical signal through the body. It offers a quick, non-invasive way to estimate body composition. Based on several metrics, it can be helpful as the indicative mechanism to evaluate and estimate nutritional status, hydration, undernutrition, being overweight and obesity, albeit within its particular scope and in combination with other measures. BIA measures metrics like body fat percentage or fat mass, muscle mass, hydration levels, and more. Depending on the type of BIA scale, it also provides metrics such as total weight, body mass index, fat-free mass or FF weight, muscle mass, body water percentage, bone density, basal metabolic rate, BMR, metabolic age, phase angle, body cell mass, etc. The BIA mechanism works by sending a small electrical signal through the body. Based on this interaction, different body tissues offer varying resistance, which helps BIA estimate fat, muscle, and water content. For example, according to Camino et al. 2023, the BIA is based on the principle that diverse body components offer different resistance to an electrical current. Lean tissues, containing healthy levels of water, larger than other components and electrolytes, offer low resistance to the passage of an electrical current, making them effective conductors of electrical currents. On the contrary, fat, bone, and skin exhibit lower conductivity and high resistance. BIA application enables a calculation of the phase angle and body cell mass, BCM, both of which are used as nutritional markers. Fat, also known as adipose tissue, are suggested to be less metabolically active cell compared to other cells. Unlike muscle cells or other active cells, it is also suggested that fat cells do not possess as many mitochondria, which are responsible for energy production. Instead, fat cells primarily store energy in the form of triglycerides and release it when needed. There is an element of a passive nature of fat cells, comparatively, which makes them potentially less metabolically active compared to other cell types in the body. Less metabolically active means that fat cells have a lower metabolic rate compared to other types of cells in the body. While fat cells do have some metabolic activity, it is lower in comparison to cells that are involved in processes like energy production, muscle contraction, or hormone secretion. Fat cells primarily store and release energy rather than actively participating in energy production or other metabolic processes. Therefore, when compared to other cell types, fat cells are associated with being less metabolically active. However, a balanced amount of fat cells, based on individual parameters, are still an important part of the body's metabolic processes and are necessary to the extent of the proper balance of a healthy individual. Even though metabolically less active, some amount of body fat is necessary for various essential functions in the body. Fat cells, also known as adipocytes or lipocytes, play a crucial role in energy storage, insulation, and cushioning of vital organs. Additionally, they are involved in hormone regulation and the immune response. Adequate fat storage is essential for maintaining proper hormone levels in the body and providing a source of energy during periods of fasting or exercise. Therefore, while overabundant body fat may lead to health imbalances, a certain amount of body fat is necessary for holistic overall well-being. Exercise can influence fat cells, making them more metabolically active in response. According to Bioelectrical Impedance Analysis, BIA, lean tissues are the most effective conductors of electrical current. For a healthy individual, healthy lean tissue suggests a well-balanced body composition because lean tissues, such as muscles and organs, contain high water content and electrolytes comparatively, allowing electrical current to pass through them easily. As an example, if we imagine lean tissues as efficient conductors like copper wires, allowing electricity to flow smoothly. There is a sort of lightness to lean tissue, which reflects in its total body weight measurement, similar to how lighter materials conduct electricity more effectively. Body composition may also be subject to general changes and fluctuations. For instance, where a healthy individual is fasting, BIA may show variable figures as compared to their normal dietary routine. In terms of body mass index, BMI, is a measure of body weight based on an individual's weight and height. It is calculated by dividing a person's weight in kilograms by the square of their height in meters. However, BMI is not a direct measure of body fat and cannot distinguish fat mass from lean body mass, muscle and bone, or indicate where fat is located in the body. This is important as the sole BMI figure alone does not differentiate the components of body mass. Therefore, evaluating BMI in accordance with other parameters would provide a more comprehensive indicator and better picture beyond just the BMI figure alone, to demonstrate, as pointed out by Cimino et al. 2023, two individuals can also have the same BMI score while different body distribution. For example, one with a greater muscle mass component and the other with a greater fat mass component. Another metric in BIA mechanism is the basal metabolic rate, BMR. BMR refers to the number of calories your body needs to perform basic functions at rest, such as breathing and circulating blood. It varies based on factors such as age, gender, weight, and muscle mass. Metabolic age is a comparison of your BMR to the typical BMR for your age group. It provides insight into how efficiently the body is burning calories compared to others of the same age. An example of metabolic age could be 34, indicating that based on factors such as BMR, weight, and activity level, the person's body is metabolically similar to an average 34-year-old individual. This comparison provides insight into the efficiency of their metabolism compared to others in their age group. Subsequently, the blanketed recommendation of consuming 2,000 calories per day, therefore, may not necessarily align with basal metabolic rate, BMR considerations, when taken into account as a whole, based on the individual parameters and their BMR. For instance, estimated daily energy expenditure plus BMR, this combined value gives a more comprehensive picture of an individual's energy requirements, taking into account both the calories needed at rest and those burned through daily activities, which are important parameters in healthy weight management. Other metrics in BIA may include body cell mass, BCM. BCM is often calculated using total body water, TBW, because water is the primary component of lean body mass and is present in all metabolically active cells. Since the human body is composed of a significant amount of water, especially within cells, TBW provides a way to estimate the non-fat, metabolically active components of the body. Bioelectrical Impedance Analysis, BIA, which is commonly used to estimate body cell mass, relies on the principle that water and electrolytes in the body conduct electrical currents. By measuring the body's impedance to a small electrical current, BIA scales can estimate TBW, which is then used to calculate body cell mass. TBW includes both intracellular and extracellular water. The extracellular water is not always accounted for in body cell mass calculation, as it is water outside of cells, but still plays an important role in several functions when in balance and based on individual parameters. Total body water is associated with being closely related to the hydration and composition of the body's cells. However, this does not mean one should consume large amounts of water all of a sudden. Rather, water should be drunk in a paced manner throughout the day, according to body weight and individual water requirements, which may differ for everyone. The intention is to work with the body and hydrate comfortably. Also, another metric based on the BIA scale mechanism is the phase angle metric, which in body composition analysis refers to the relationship between resistance and reactance in a bioelectrical impedance analysis. It provides information about the cell membrane integrity and the amount of water in the body's cells. Cimino et al. 2023 also suggest that health imbalances may exponentially rise in a state of malnutrition. Malnutrition includes both undernutrition and overnutrition, further suggesting that an appropriate diet should reduce both the weight and the body fat, but not the body cell mass. This is an important point, as typically nutritionally poor quality foods may exercise a depleting or taxing effect and therefore may be counterproductive. Further, this principle closely aligns with the holistic approach. In terms of effectiveness, it is suggested that BIA scales are currently the most effective and reliable technique for the estimation of body composition and fluid status based on rapidity of their execution, their non-invasiveness, and their low cost. This makes BIA as an indicative tool, promising depending on suitability and needs. Similarly, the identification of individual dietary and nutritional needs accounting for body composition are reinforced by classical sciences. Looking at the term holistic, it refers to the approach of considering the whole aspect or more than a singular aspect, for example, physical, mental, emotional aspects of an individual. In the context of well-being, a holistic approach takes into account the interconnectedness of various factors that contribute to the cause and effect principle. This often involves integrating a multifaceted or multidisciplinary approach, working towards optimal well-being incrementally. In terms of the bioelectrical impedance analysis mechanism, different types of BIA scales are available for both professional and domestic use. Professional machines may provide detailed metrics, while domestic machines may help with personal well-being goals. Several reputable studies suggest that BIA scales are effective and reliable for estimating body composition and fluid status. However, their accuracy can be influenced by factors like hydration and fasting. Finally, the appropriateness of utilizing a biometric impedance analysis (BIA) scale depends on an individual's health status, age, and the effective use of the metrics, either under professional guidance or domestically, as they may not be suitable for everyone. Remember, the body is a live organism and thus subject to daily fluctuations. Using the BIA scale on an empty bowel and bladder and in a hydrated state may be helpful, subject to fluctuations and variability.